When I say the Mediterranean diet, that is a diet that's associated with a decreased incidence of Alzheimer's disease, decreased incidence of hypertension, diabetes, cardiovascular disease, stroke, just an array of great medical things it does. And many of you may know the Mediterranean diet by other names. You may know it by the Maker's diet, the Hallelujah diet. And it's not so much it's the Mediterranean diet. It was just there was a group of people that ate that way that got studied, and the Mediterranean diet name got pegged to that process. Now, I've been using the Mediterranean diet throughout my medical practice for many things for many years now, but we're speaking of it specifically as it relates to Alzheimer's disease. There was a study done at Columbia University where they had over 2,000 patients. They had three groups. One group got the Mediterranean diet all the time, one group got the Mediterranean diet some of the time, and one group rarely got the Mediterranean diet at all. They studied them for a total of 8.1 years. They evaluated them about every 1.5 years. And what they found was the people that ate like the Mediterranean diet or ate according to the Mediterranean diet, at the end of that time period had a 40% decrease in the incidence of Alzheimer's disease. That's a very big deal. And not only did they have a 40% decrease in the incidence of Alzheimer's disease, but it was statistically significant. Meaning, for those of you who understand what I'm saying, it had a p factor of 0.07. Again, a p factor of 0.07. And actually, I said that wrong. It had a p factor of 0.007, which means that this would not have happened by chance in 1 in 7,000. 7 people out of 1,000, this could have happened by chance. And we call that very scientifically significant for those of you who understand that terminology. But the point I'm getting at is we know there's a couple of things that can be very effective in helping to treat Alzheimer's disease. We know that the Mediterranean diet or eating that way is very effective. We know that the medications can be helpful. We also know that exercise can be very helpful when we're talking about treating Alzheimer's disease. And things we think are helpful are reading and staying very active in your mind and the types of things your mind is doing. Crossword puzzles. Now, this can't wait until you're 80 to start. This needs to start in midlife where you're reading and getting involved in other activities where your mind is going to really be digging in and learning and staying sharp and staying educated. Those things, we find that the more educated a person is, the less Alzheimer's disease they get.